Early on during my training, I remember caring for a patient in the emergency department, and part of care in the ED, especially when we get busy, is taking care of patients in hallways. And distinctly remember caring for a patient in the emergency department. He was placed into hallway one, which is probably the busiest intersection within the emergency department because everyone flowing in and out of the emergency department, whether you were walking in or you were being brought in by ambulance, you had to go by hallway one. And this patient was placed there at the beginning of my clinical shift in the emergency department and for the entirety of his care in the emergency department. And at the end of my 8 or so hour shift in the emergency department, he was still there, about to be admitted to the hospital. I was walking by him one last time as my shift had ended and he was about to go upstairs. And we had a brief interaction that really stuck with me and has really helped to shape my career, but really my thoughts around health equity in not only just emergency medicine, but in medicine as a whole. And in our brief interaction, as I was about to leave and he was about to go upstairs to be admitted, he stopped me and he asked me a question. And my assumption was his question was going to be about whether what his condition would be, or if he needed more pain meds, or if he needed something simple as a pillow or a blanket. But instead, he asked me, "Hey, doc, why did they put all of the Black patients in the hallway?" And it was the first time that I, who was a part of the healthcare system where I was caring for patients in the hallway, where I was caring for patients throughout the emergency department, actually stopped to realize that I was operating within a system that was showing bias against certain patient groups. And what we did was when I heard that story, obviously I tried to console the patient, answer his question appropriately. But I recognized that the patient was pointing out the flaw in the system. He was pointing out the racism in the system. And so I brought this up to leadership within the institution. I brought this up to leadership within the emergency department. And we had a conversation about whether this is true or not. And I think it gets back to Lori's point about having the data. And we actually ran the numbers. And unfortunately, from a quality perspective, when we looked at the data, when we looked at the way we were caring for patients, there were certain subsets of patients who were being placed in the hallway compared to others. And it tended to be our minority patients, those Black and Latinx patients, patients with limited English proficiency, and then also patients who are homeless or unhoused. And it just showed that there was bias with the emergency department.